All right, welcome to another Around the County with Supervisor Jim Desmond. I'm Miles Himmel, Communications Director for District 5. And we wanted to do a topic here today that we've heard a lot about. Supervisor, I know you and I have heard the word monoclonal antibodies, treatment. What are they? We've heard a lot in the rooms, we've read the headlines. And so I'll speak for myself, Supervisor. I'm not smart enough to talk about it. Maybe you are, but that's why we had to get an expert on. Dr. Tuteur, and I'm going to read from your bio here. You are the Deputy Chief Medical Officer, Medical Care Service Division Lead, Healthcare Sector for Outreach and Education for the COVID-19 response for the county. Doctor, thanks for coming on. And what's a monoclonal antibody? What is it?
Well, thank you so much for having me this afternoon. I'm a family practice doc by training, so I like to keep things simple so we can all understand it and really know the basics. A monoclonal antibody is a protein. It's a medication protein that's made in the lab, doesn't have any blood product in it, and we've used it through the years for treatment for many different conditions, from cancer to other diseases. What's really amazing about this is just since the SARS-CoV-2 virus has emerged, the scientists have been able to identify monoclonal antibodies, or these proteins that fight the SARS-CoV-2 virus, or the virus that causes COVID. So we've got this protein that if someone comes positive with COVID, we can treat early on with this protein or this medication and help their body fight the virus and get better faster and reduce the risk for a subgroup of people, reduce their risk for getting sicker.
Well, so how does somebody go about getting this monoclonal treatment if they warrant it, and what are the qualifications to get it?
Well, the first thing we want folks to do is, of course, get vaccinated. That's the best protection before you even get the disease. But if you test positive or you start to get symptoms of COVID, we really want people to get tested right away. And we've got amazing resources here in San Diego County to do that. Because if you test positive, and of course, once you get symptoms, you want to isolate at home. But if you do test positive, we want you to either call your regular doctor, call your health system, say if you're in the VA health system or something like that, or call the Monoclonal Antibody Regional Center number. It's a county number for all of our different sites. It's a single phone number, and we'll share that with you. We want you to call that number to find out if you medically qualify for this treatment. It's that 619-685-2500 number. Even I can remember it, which I'm so glad they picked an easy number because I've been saying it a lot. But all you have to do is, once you test positive and you have symptoms, call that number and we'll help you out.
So what does that get you then? As far as, I think you mentioned, it reduces hospitalizations and deaths and things like that. So can you give us some of the numbers on that for this treatment if you get it early enough?
Absolutely. So we want to get people who have symptoms, who have had symptoms for 10 days or less, so early on in COVID, which is why we say get tested early, and people who are 12 years old and older. Then once you're in that group, we ask questions to make sure that you are in that medically eligible group. So it's all the people that they've done the clinical studies on to see who this medicine or the monoclonal antibody helps. It turns out that it really helps people who are at risk of developing serious illness. So we make sure and ask, are you 65 years and older? Are you pregnant? Do you have diabetes? Do you have a heart disease like high blood pressure? Do you have a lung disease like emphysema or asthma? If you fall into that category, the clinical studies have shown repeatedly that it reduces risk of an emergency department visit, reduces risk of a hospitalization, and even reduces mortality risk by a combined 70 to 85%.
That's phenomenal. And it's a one-time treatment. You don't have to get multiple shots. It's one time. Is that right?
It's one-time treatment. You either get the medication in an IV. So you sit there for a little less than an hour, get the medication. We watch you, make sure you're okay after getting that IV, and you go home. Or you can get the medication according to some of these medications or one of them is available and approved for use through the emergency use authorization, approved for use in injections right underneath your skin. So you get that as injections. Takes far less than an hour to have that done. We watch you for an hour and then you can go home. And most people start feeling better within 24 hours.
Oh, that's phenomenal. So is this, we hear about experimental, we hear about emergency authorization, we hear, Pfizer got approved by the FDA so what status is this monoclonal treatment in? Where is it right now? I guess as far as the FDA is concerned.
Yeah, it's a great question. All these abbreviations are incredibly confusing and they keep changing. And that's been one of the really hard things with COVID is we're getting all this scientific information and normally, medicine changes. Like 1 year we'll be using one blood pressure medicine. The next year, some new studies came out and says, oh, well, it looks like this one might be better. And in the time of COVID, we're getting all of that compressed. So experimental drugs are drugs that are being studied. We don't know if it works or not, but they're being studied usually under an NIH or National Institute of Health protocol. And if you want to try and be part of a clinical trial or an experimental drug to help advance science and see how it works, then you actually enroll in a clinical trial. You don't know usually if you're getting the medicine or the placebo, kind of what we called the sugar pill. And they do studies at different sites for a while and gather the data and then look at it. And that's an experimental drug. We don't know if it works or not. The medicines that have been approved and even the vaccines that have been approved for emergency use authorization are ones where the clinical trials are done, where we have data, and that data is presented to so many different committees and meetings. So we know even with some of the vaccines and the boosters, we hear about last week, a certain committee of the FDA heard and studied all the data that was produced by the clinical trials. And then that group approves it, which goes on then to the ACIP or a subgroup of the CDC and the FDA, and then the FDA and the CDC directors sign off, and all of that kind of stuff for emergency use authorization. So experimental is you're still on the clinical trials and you don't even know if you got the sugar pill or the real medicine. Emergency use authorization is that these trials and a lot of data have been presented to a lot of different experts, and there are different votes that are public and people can see and look at the data, and they all decide and recommend, yeah, this medicine is more likely to help you. It's more likely to help you than to hurt you. And we just haven't studied it for enough years, or we just, are cautious and just want to wait a little bit longer, because here with the FDA, we don't approve things right away. It takes a while. And so that emergency use authorization is what the vaccine started off as, and it's what the monoclonal antibodies, all three of them are currently in, is emergency use authorization for the indication of COVID. So even when we're used to having a medication and it's been approved by the FDA, sometimes if we say, oh, it can be used, not just for pneumonia, but it can be used for a skin infection, a cellulitis as well, it has to go through the whole new process. So even though we've used monoclonal antibodies, we're in the emergency use authorization phase. We've given more than 2,500 doses just here in San Diego County, but it's still emergency use authorization. So we are able to give it within this little box of indications, and that's exactly what we follow. And that's why I say, once we know you're 12 and up, once you know you've only had symptoms for 10 days and less, and once you know you've tested positive, we still need to make sure you meet this little box of indications, because these are the criteria by which the clinical trials and the FDA has said, hey, it is so much more likely to help you than hurt you in these criteria. And that's exactly what we follow here in San Diego.
Okay, so I'm 65, and
you don't look it.
Well, thank you. Well, yeah, I'm 65 and a quarter, I guess, if you go back to that. But so let's say, okay, if I start getting symptoms, I test positive, and I'm only a couple days into it, as far as I know, then I could get referred. So if I call the 619-685-2500 number, I tell them, where I am, where I guess that I tested positive, I'm showing symptoms. So then what happens? What would I'd be directed to do what?
So then what happens, so you call that number, you either have a nurse who answers the phone or you leave a message and they call you back within a day or so. The nurse then will go through that criteria and say, Supervisor Desmond, how old are you? Do you have any allergies? And we just ask, are you vaccinated or not? Doesn't matter, doesn't have anything to do with the criteria. And we gather that information. We ask what your zip code is. It does not matter if you have insurance. It does not matter what your immigration status is, but we gather that information so we know where the needs are. And we say, okay, here, can you come in at this time for an appointment? And usually appointments are offered the next day. Sometimes they're same day if it's early in the morning, but usually by the next day, those appointments at the Monoclonal Antibody Regional Centers, that's when those appointments are offered. And that's it.
Well, does it matter if I've been vaccinated or not?
It does not matter for treatment if you've been vaccinated or not. We try to avoid people getting COVID-19 by vaccination, but if you get it and you fall into the criteria for being at high risk, the monoclonal antibodies have been shown to help you whether or not you've been vaccinated previously.
Well, it sounds pretty straightforward. There is, and also I think you mentioned earlier in our talks that there is a post-exposure prevention use for the monoclonal. Can you briefly, explain what that is?
Absolutely. So in addition to the treatment, the FDA has been studying and the clinical trials have been looking at whether or not these same medications, same dosage, is helpful in preventing people from getting COVID if they've been around someone who has COVID. So the studies looked at people who were in nursing homes and maybe their roommate was positive or someone in their nursing home was positive and they weren't. Would it help by giving them the monoclonal antibody? Would it help prevent them from getting sick? The studies also just looked at, hey, are you living with someone who comes down with COVID and you're living with them in your household? Would it help you by getting that monoclonal antibody to prevent you from getting sick? And in both of those cases, the answers are yes. But like anything, as we're dealing with this pandemic, we have different phases of surge. And so as we've had this Delta surge, then there's been more use of the monoclonal antibodies. And so the feds are making sure through the Federal Health and Human Services that we have an ample supply. So right now they've asked us to prioritize treatment over the prevention medications, except for certain situations. So for example, there might be some situations in nursing homes where it's really important to give it to people to prevent them from getting sick, especially if they haven't been vaccinated, if they're on chemotherapy or aren't expected to mount a really robust immune response, even if they've been vaccinated. So those are some cases that we're still using it now. And that same medication of the 3 monoclonal antibodies, there's one made by Regeneron and the product is called RegenCove. And that product has emergency use authorization to be given under the skin. So that's the one that we can give under the skin in addition to the IV. It's also the one that has had the studies to show that after exposure, that is one that if we give that monoclonal antibody, it prevents folks from actually coming down with COVID. So one of those 3 monoclonal antibodies have the emergency use authorization for that, but we're being very careful in making sure that we are treating our sickest people, our folks who are most at risk, because overall, just like with the vaccines, the goal is to prevent hospitalization and it's to prevent death. And the way we do that is making sure that our most vulnerable folks are not going to get sick. And then it also helps preserve our hospital capacity for all of us who need that hospital for any use, even non-COVID.
So if you mentioned there are monoclonal antibody regional centers in San Diego County, and people, you can't just walk up and knock on the door and say, I want to get this. You need to go through the vetting process with that, with the phone number we mentioned earlier. So how many do we have in San Diego County? Is there a handful? I have no idea. How many regional centers do we have that can give this antibody?
Well, we call them marks because everything else having to do with monoclonal antibodies is so difficult to say, including the names. So we've had 7 different marks throughout the time since February 9th, and we try to make sure they're in the right location, and we work with community partners as well as the state and our feds. And that's why we like to know, for example, people's zip code when they get the treatment, so we can make sure we've got everything where it needs to be. Right now we have 4 different sites. So we have a mark at Vista Community Clinic in Vista. We have a mark at Escondido, which is in Escondido. We have Family Health Centers, which offers the monoclonal antibodies at 2 sites, in Chula Vista and in Hillcrest.
Okay.
And we've had partners with San Ysidro before. We've had partners with Palomar Health, and we've had partners with Neighborhood Healthcare. So we just, like everything else with COVID, we try to stay flexible, we try to stay agile, and really go with where the data is to show how we can be where our San Diego residents need us to be.
Well, Miles, do you have
Yes,
anything
sir.
to kind of wrap us?
Yeah, I was just going to kind of wrap it up with, I mean, Doctor, this is learning about it. I think many of the people listening or watching this are going to be amazed. You gave the stats, 85% reduction of hospitalizations and death. I mean, this is a life changer treatment here. And I think kind of the key is to get on it early, is that kind of seems to be. So that was going to be kind of a lead into my final question. What's your message to kind of wrap this all up for people listening?
Well, I've got 2 messages. If you'll let me
I'll let it.
have two last words, not just one last word. The first message is get vaccinated. If you get symptoms of COVID, get tested and stay home while you're sick, but get tested. If your test is positive, then either call your doctor and or the mark at that 619-685-2500. So that's kind of the overarching thing to keep our community safe, right? And to keep our hospitals open. The other thing, though, is you didn't ask me any nerdy questions about how the monoclonal antibodies work. You want to know those, or is it just hard enough to say these silly words?
Take them.
Everything else.
We're not smart enough to know what to ask. I remember that.
Yes, you
are.
You're,
Nerd out
if
on
you can
us.
fly an airplane, supervisor, you're more than smart to know this.
That's easier. That's easier.
Well, I don't know. So the way I think of it is kind of like you want to keep your house safe, right? And you've got your door locked and you need to get a key to get in. Well, I think of it like this. If you give someone a vaccine, it's kind of like having those bright lights outside your house and maybe some alarms or even like some security guards that are like, don't even come here. This is a place you are not welcome. And no one, comes into your home because you're safe, right? Well, safe for whatever reason, you get that little, SARS-CoV-2 virus walking up your sidewalk and coming up your front steps, and they got a key out, which is kind of like, see these little, I don't know if you can see it, but I always like to have these little spike proteins here because this is the coronavirus here. And these spike proteins are kind of like a key, and that key is trying to get in my door. Well, the monoclonal antibodies are like stuffing wads of cotton into your lock. There is no way you're protecting yourself with those monoclonal antibodies on your cells, and there's no way that little key from the virus is going to get in there. And that's what we're trying to do with the monoclonal antibodies. Is you may get up on my property, you may even like sneak one virus in my door before I get all that cotton shoved in there. But I want that cotton shoved in there as soon as possible after I start getting sick, so no more coronavirus can come in. They can't spread, and I can sweep them out of my house really quickly because they're not that many and they're not making me sick. That's how I think of how these work. And it's a scientific, I'm a nerd. I think it's so cool to understand it and to know it, and just to have these available for us is so important in our community. So thanks for the opportunity to share my inner geek and talk about it a little bit and talk with you today.
Well, that was excellent bedside manner. I understood it all. And good family doctor analogy. I appreciate that because, yeah, we're not smart enough to ask the more technical questions, but but this is good. I appreciate you doing this because this, we get a lot of questions. I'm not a doctor and I'm an engineer. I'm a nerdy geek, but in another area. But so I think this will help a lot of people and ease a lot of minds and people knowing that, hey, if I get it and I get it early enough, I got a shot of not having to go to the hospital if I can get this monoclonal antibody soon in my treatment and if they qualify. So I think it's great news for our constituents and everybody in San Diego County. So thank you, Doctor.
Thank
Wow,
you so much.
anything else?
Thank you.
All right, thanks a lot. Thanks so much. And we'll keep in touch. And if you have any other scientific breakthroughs in the next couple of days, let us know.